I have no disclosures to give other than I am probably your first and only speaker who knows almost nothing about implementation and dissemination research. So I have been learning along with the rest of you. And also let me just say that at the NIDCD, the main part of my job is that I oversee the Hearing and Balance program. But I also have been the person at NIDCD Institute-wide who's been trying to encourage Translation 1 and Translation 2. And so it's in that capacity that I'm here talking to you today. So let me just, what I'm going to do is just tell you just a tad about NIDCD, and then I'm going to talk to you sort of about our foray into health services research, implementation, dissemination research. In your handout, you have some information on some specific funding mechanisms. I'm not going to talk about that today. My primary message to you is that NIDCD supports this research, and we really want to encourage you to collaborate and to truly consider sending us research applications in these areas. So NIDCD is a very small part of NIH. We're only about less than 2% of the overall NIH budget. Our NIDCD budget was about $400 million last year. We have very strong support for individual research grants. We have fewer center grants than some of the other institutes. And we also have very strong support for new and early stage investigators. And we have several funding programs for new and early stage investigators that are unique at the NIH. So NIDCD does hearing balance, smell, taste, voice, speech, and language. We support basic, clinical, and translational. We are relatively new players to this outcomes health services research. We have had limited activity in implementation dissemination, but we have several current funding opportunities that are available to you, and that's what I'm going to tell you about today. Just so you know, hearing and balance is about 60% of NIDCD funding. Speech, voice, and language make up about another 25%, and that has been remarkably stable over the last 25 years. And this reflects the size of the community sending us grant applications. This is not a predetermined set-aside. So how did we sort of move into this area? So we kind of did it through hearing loss. It's a leading public health concern. 17% of our adults have some degree of hearing loss, but only 20% of those who require intervention actually seek help. So this is our implementation gap, right? So for many reasons, I think it's very fair to say that the needs of the majority of adults with hearing loss are not being met. And so in 2009, we had a research working group on accessible and affordable hearing health care. So we were looking at the hearing healthcare system as a whole from the public health perspective, and this really was a new direction for NIDCD. And the overarching goal was to increase the number of individuals receiving quality hearing health care. But to do that, we had to back up and start looking at the hearing healthcare system, what was working, what wasn't working, and identify innovations and opportunities. Well, we came up with a lot of recommendations. I'm not going to go into those. You can find them on the web or in an open access editorial. But the point is that many of those research recommendations, they were focused on outcomes in health services research, implementation, dissemination, community-based participation. And we knew that in order for our community to do that, we had to begin collaborative, sort of multidisciplinary investigations. And we needed people with expertise that, to be honest, was absent or only minimally represented in the NIDCD portfolio. Some of those areas I've listed there that we have very little research in. And so in order for us to address these research recommendations, we really had to encourage our community to go out and seek new collaborations. And that's going to be one of my primary messages to you today is collaborate. So following that, we had another workshop in 2012 at the Academy Health Research meeting. And the Academy Health Research meeting is where a lot of the health services implementation dissemination research is presented that's funded from the VA, many other NIH institutes. So we expanded it. We brought in people in voice, speech, and language. We brought in NIH review people. We brought in people from the VA who really are some of the experts at this. We brought in professional orgs, including ASHA and the ASHA Foundation. We tried to get a sense of what was ongoing, and there was very little, minimal, one related to NIDCD. So we brainstormed on ways that we could begin to encourage our communities to move in this direction. And we, along the way, invited other NIH institutes to come and interact with us. And so we decided that we wanted to offer administrative supplements to our currently funded grantees to encourage them to reach out with outcomes health services researchers. And I'm using outcomes health services research as a very broad definition, sort of to include implementation, dissemination. And so we gave supplements so that they would try to seek individuals who had some of these additional expertise to think about shared areas of interest where they could submit a future grant application. So we funded 13 of these in 2012, and again, collaboration was the key to this. And so we wanted them then to have a funding opportunity announcement to come into to say, hey, NIDCD wants these grants. So we published an FOA. It's titled Disorders of Human Communication, Effectiveness, Outcomes, and Health Services Research. And it is very broad. It's almost like a shotgun, but there is very little research that you all as a group would, could not fit under this if you chose to go in this direction. It includes community interventions, dissemination implementation, patient-centered and service-centered variables, health disparity. This is active, and we have it both for the R01 and the R21 mechanism. The types of applications that come into this, they're going to go to different study sections at the NIH than what many of you are used to. Many of you are probably used to LCOM, which is the Language and Communication Study section, or for hearing, it's the Auditory Disorder Study section. The study sections that review this type of research, they review them for many discipline areas, cancer, heart disease. They would review them for communication disorders as well. Some of those NIH study sections are called community level health promotion, community influences on health and behavior, health disparities health disparities in equity promotion study section, health services organization and delivery. I've had grant applications go to all of these study sections. So the focus is on the methodology and what you're trying to do, as opposed to having a study section full of individuals who understand speech, voice, and language concerns. These study sections, which you can look at them on the web, you should go look at their rosters and see the kinds of individuals who serve on these study sections, what their expertise is, but they understand how you design a grant to work with communities or to work with health promotion. So anyway, so this is where a lot of these would go. Now, in this particular FOA, we also reference an implementation and dissemination PAR at the NIH. David has led that, and he's going to talk after me, so I'm not even going to mention that at all. But that's also one of the funding opportunities that's out there. So in order to send our message to the community, we have a national strategic plan. So in 2012, it was time to renew that. And so we added, and I'm really pleased and proud about this, we added a brand new priority area 4 called Improving Outcomes for Human Communication. This was not there before. And in this priority area 4, basically we seek to accelerate the translation of discoveries into practice, to increase access to health care, and to enhance the delivery quality and effectiveness of care. And so this really is to say to the community, to the reviewers, and to the NIDCD Council, we really want to push forward in this area. So under the new strategic plan, and you guys can go read it on the web, there are specific topics under hearing and under speech, voice, and language that are considered priority areas for NIDCD. Under hearing, one of the priority areas is hearing healthcare. Another area is, of course, the implementation and dissemination research. There's sub-bullets under all of these. And also community-based participation in research. And I want to say that in this context, the community can be a community of providers, it can be a community of patients, it can be a community of families. And so the word community can be used very broadly. So for example, we have practice-based networks of one that we fund that is otolaryngologists, speech pathologists, and audiologists. This can be a community. Under speech, voice, and language, delivery, translating interventions to new delivery models, screening, and community-based research again. And then also training is listed, training clinicians and physicians in the science knowledge base, as well as developing dissemination experts. So it's kind of what is happening here, and this is a part of it. So we have several ongoing funding opportunities. These are the ones I've mentioned already. We also interact with several other NIH on funding, other institutes on funding opportunities that are really relevant. Some of those you might want to look up. I'm not going to talk about funding mechanisms other than to say that really the first step in funding success requires using the appropriate mechanism. And NIH has a lot of them. They're used very different ways. Different institutes use different ones. Each is targeted to a different population and a different purpose. And so what I would ask you to do then is contact us early in your planning. I want to take just a minute to acknowledge your commitment to quality research. I always say the only reason I have my job is because there's people like you who are willing to try to make a living based on the nuances of congressional appropriations and peer review. And both are very unpredictable. And I really do mean that most sincerely. And so for any ideas that you might have, please do contact us. If it's hearing balance, it would be me that you would come to. Many of you know Judith Cooper, who manages the language portfolio, and you also know Lana Sheckham, who does speech and voice. And then for career training, Dan Sclair is just phenomenal and will spend lots of time with you. So with that, I'm done, and thank you.
Steve Camerata from Vanderbilt. Thank you so much. Very, very helpful. So two questions. The first is that in the proposal call that you listed, it's one that doesn't have specific resources attached to it. And so one wonders how it will fare, you know, given that there's a lot of things like that that are competing. And the second question is, you know, my interactions with some of the other study sections and so on, communication disorders is a relatively low priority relative to cancer, heart disease, diabetes, and so on. And so since we don't have people on those study sections with our culture, I'm just concerned about how they'll fare in that kind of a review.
You know, that's a very common comment. Thank you for that. A couple things, two things I would say. One is that even though this funding announcement is, doesn't have specific funds attached, when we have a funding announcement for research that we're trying to encourage, that sort of has a higher priority for us when it goes to council. And so NIDCD has 20% of their funds that are set aside for high program priority areas that council then can pull outside the pay line, assuming that the score is reasonable. So that is a factor that we do consider. As far as communication disorders not being life-threatening, like cancer, how is it handled in study sections? I really think that has changed over the years. I think study sections do value communication now, and I also know that we, as program people, will contact SROs, the scientific review officers, when we have grants going into a study section, and that doesn't have expertise in hearing or speech voice language, and we will ask them if they can bring ad hoc reviewers on just to speak to the value of that particular science. It might be true that there's not a standing study section member in that area, but if you go look at some of these study sections, most of the standing study section members have more public health perspective. They may be a gerontologist or a pediatrician, but you're going to find a lot of biostatisticians, public health emphasis folks, and so they are very used to dealing with applications in all areas and realms of public health. And so it's a whole different concept than what LCOM or AUD or some of our disease-specific study sections kind of come from. So it's still tough. It's still tough, but you know, we're there, we're watching, we're encouraging, and we'll do our best.